My name is Sisay, and I am the country head for the Tony Blair Institute in the Gambia. At the Tony Blair Institute, we believe that governments exist to deliver, and our work is focused very much around supporting leaders in African countries and elsewhere in delivering on the mandate given to them by their people. Often, this involves that Tony Blair Institute teams will work in the center of government supporting the president and his office in making sure there is evidence-based decision making and that there are clear structures, processes, and people to deliver on the government's mandate. We also work in various ministries across the country to help deliver on the mandates of those ministries, be that in agriculture, private sector development, health, finance, and a host of other areas. The reason I joined the Tony Blair Institute is because in the 2014 to 2016 Ebola outbreak in West Africa, I worked as the head of the National Ebola Response Center of Sierra Leone's Situation Room. As director of the Situation Room, one of my most valuable assets were a good number of free advisors that were given to me by the Tony Blair Institute to help me structure my Situation Room, to help me collect and make sense of the mass of Ebola data that was coming at me, and to help me design strategic and tactical interventions. They were also instrumental in helping me train my local Sierra Leonean staff so that they would be able to do these for themselves and not need any foreign support. Now that we have COVID-19, the entire Tony Blair Institute and all of its staff and resources have been pivoted towards supporting our partner governments. That means over 200 people across the world, both in the African countries we support and at the center, are working to help our governments answer big and small questions around COVID. Our advice range from helping them structure their COVID-19 response, helping them decide what data to measure and why, and helping them make tactical interventions in the response. How do you engage religious leaders? How do you do social mobilization? How do you encourage the community to do the behavioral changes you need to end transmission? We are also working on the big questions. So for example, at the center, I am working with a team of modelers and several of my colleagues and other partners and universities. And together we are trying to help African governments answer questions around what is the likely spread in this district of my country? How long do I have before I run out of beds? What is my forward forecast for how much equipment and PPEs I'm going to need over the next 3 months? But again, will social distancing work if I introduce it in my country? Am I testing enough? How do I close lockdowns? These are some of the big and small questions that we are helping our countries answer. We are very proud at the Institute of our work supporting our counterpart governments at this time, and we look forward to the end of the COVID-19 crisis. Until that happens, we will keep at it. Thank you.